Good day, my viewers. I'm Mrs. Uduak and I'm a nutritionist. And it's actually World Breastfeeding Week, and I thought to share with us some salient information as it regards benefits of breastfeeding, both on the child and also the mother. And I'll be looking at the immediate effects and also the long-term benefits that breastfeeding confers on the maternal health. Now, the offer of maternal breast to the baby is an unquestionable right to both the mother and the child, and all efforts should be made to promote, follow and maintain exclusive breastfeeding up until 6 months, and also to supplement it until the child approaches 2 years of age. Although it is widely known that breastfeeding offers benefits to both the mother and the child, but most of the available information highlights only the benefits of breastfeeding on or of breast milk for the children, while the effect of breastfeeding on maternal health is rarely mentioned. And so I'm using this medium to actually share with us the benefits of breastfeeding on maternal health, and especially the protective effects it has on breast cancer. Breast cancer is one of the most gynecological tumor in women. The largest incidence of breast cancer mostly occur in large income regions. And in fact, in developed countries, breast cancer is the leading cause of cancer deaths in women. And among the factors that are responsible for breast cancer, we have a short period of breastfeeding and also non-involvement in breastfeeding. And now I would like to explain the hormonal changes that actually occurs during pregnancy, at the point of childbirth, and during lactation. You know, the physiology of the woman undergoes different hormonal changes. Now, during pregnancy, there is a release of the hormone called progesterone and estrogen. These hormones are being released so as to maintain healthy pregnancy through the course of the gestation period. And as the woman approaches the stage of childbirth, there's release of the hormone called oxytocin. Oxytocin helps in uterine contraction, which helps to bring the baby out of the mother's womb. When we get to the phase of lactation, once the baby is being put to breast, the suckling stimulates the release of the hormone called prolactin. Prolactin is also responsible for milk production and milk letdown. And so these are the activities, the hormonal changes that occurs in women. At the point of childbirth, there is a drastic reduction in the hormone called progesterone and estrogen. The fact that they are reduced doesn't mean that they aren't there. They are there. But the activity that suppresses this hormonal activity is what we call lactation and breastfeeding. That's why we encourage mothers to actually, be encouraged to breastfeed their child. When nursing mothers are not involved in breastfeeding, the level of estrogen actually increases the cell proliferation and differentiation. A woman who is not breastfeeding her baby is at high risk of developing breast cancer. And so this is a call to mothers out there using this medium of World Breastfeeding Week to actually encourage moms out there. You can do it, and it's something that you should be proud of because of the effects it will confer on both your child and also yourself. According to UNICEF, a 16% increase in the proportion of mothers who breastfeed for 6 months can reduce the expected prevalence of breast cancer by 1.6% yearly. Also, there are several studies that have proved beyond reasonable doubt the positive effect of breastfeeding on the protective effect on breast cancer. And so I would like to to encourage moms out there. Aside from even the protective effects of breastfeeding on breast cancer, we also have some other immediate benefits that breastfeeding confers on maternal health, and these are uterine contraction, reduction in bleeding, lactation, amenorrhea, also reduction in weight, and also improvements in body image. And so these are some of the benefits aside from the protective effects that breastfeeding has on breast cancer. Thank you so much for listening. You can do it. Thank you. Bye.